I'd like to talk to you a little bit about a few of the patients that I've cared for. The first being Amber M. Hi.
Hello.
How are ya?
Good.
When did you first notice that you had a problem with your chest?
5th grade?
5th grade.
6th
So
grade,
you were
around there.
10 or so, 10, 11?
Yeah, 10.
How did you feel about it? Let's start with
I thought it was funny.
You did?
I did, because I didn't know, I thought it was just something weird about me. I didn't know it was like
Uh-huh.
medical.
Uh-huh. And it being weird about you, did that cause you distress, or did it just
Well,
sort
at
of...
first it didn't, but like as I got older, it like kind of bugged me a lot.
Enough so that you weren't comfortable?
Definitely.
Yeah. How did you learn that it was something that could be fixed?
I was in the car with my friends and her mom,
Uh-huh.
and like they were saying something about it, and then I was like, oh, that must be what I have, because like...
So that was the first time you
Yeah.
heard the name Pectus Excavatum. Uh-huh.
And so I looked it up on the computer and I told my
There you
mom.
go. There you go. And how did you feel back then physically?
It got to a point where I couldn't do some of the strokes for swimming because it was just too hard on like my lungs or something.
Uh-huh.
And like for track, I couldn't really do much of the running because it hurt kind of.
Uh-huh.
Like when I was running and after I would run.
Sure.
With the swim team, I just noticed all of a sudden she wasn't keeping up with everyone, and
Right.
I kind of told her, "Oh, you just need to try harder." And it was just like,
Which is not uncommon.
Right. It wasn't really believing that there was a reason for it. I
Uh-huh.
didn't know.
Once you knew that there was a problem, how long did it take you to reach out to the medical community, and how did you do that initially?
Well, she actually went online and found you online. And
Is that right?
And she told me about you, and she had me
Lucky
go online.
us, right?
She
Yeah.
did. She had me go online and read about it, and she told me that she wanted you to do her surgery.
Wow.
2 months later, my husband got a job in San Diego, and we moved here.
Right.
We contacted you, and just kind of went from there.
Was it frightening actually knowing that there was an operation that could potentially fix things, or was that reassuring?
It was kind of both. It
Mhm.
was like, it was kind of scary, like, oh,
Uh-huh.
I'm gonna be like knocked out for like 6 hours and they're gonna be cutting me open.
Right.
But, like it was kind of reassuring to know like, oh, but then everything's gonna be good again. Like I'll be
Right.
able to join swim team again,
Right.
and I'll actually be able to like run in the track and stuff.
Now that you've gone through it,
Mhm.
looking back on it, was it worth it?
Yeah, definitely.
What makes you so sure?
I'm
What-
like more confident. Like I can like, I don't know, wear clothes without like wondering, oh, do I look super like weird with this whole indented thing?
Tell me a little bit about the operation. How did that go?
I honestly don't really remember.
That's a good thing. We must have managed her pain pretty well if she doesn't
Very
remember.
well,
Huh?
yes.
That's great.
Yeah,
And that's not really that uncommon, you know, that once they're removed a few months from the actual event, remembering the fine detail is something that you and I remember more than the patient.
which is good.
Yeah,
and they
it
did
is.
a great job at the hospital. It was
So let me tell you a little bit about what you might experience in the pool, okay? You may have a little bit of soreness on one side or the other. It tends to be more on the side where the stabilizer is. Do not be surprised if during the first week or two that you're back in the pool, you have a little bit of discomfort
Okay.
on the left in particular. If you do, nothing to be too terribly concerned about. You can try a little bit of Motrin or Advil just to be sure that you know that it might stir up a little bit of inflammation and discomfort, especially on your left side once you start to actually work out in the pool. Okay? Some people will even have a little bit of swelling intermittently on one side or the other. If that occurs, it would be best to stay out of the pool for a couple of days until the swelling goes down. Sometimes there's a little inflammation in and around the bar that will cause a collection of fluid around the end of the bar. Don't worry, it's not an infection. It's nothing that you need to be.
Gross.
Yeah, but it might happen, just might. So Just a little rest will take care of any swelling, and a little Motrin will take care of any discomfort that you want to do something about. Doing something about it is taking a little bit of Motrin or Advil. Okay? Great. Thanks for coming.
Can't believe it, is it really me? I'm so happy to be debt free.